What is the freeze response in anxiety? Anxiety is a common emotion that everyone experiences at some point in their lives. It can be triggered by various factors, such as stress, fear, or uncertainty, and it can manifest in different ways. Some people may experience physical symptoms like sweating, palpitations, or shortness of breath, while others may experience emotional symptoms such as panic, worry, or restlessness. One of the less well-known responses to anxiety is the freeze response. In this essay, we will explore what the freeze response is in anxiety, what causes it, and how it affects individuals who experience it. The freeze response is a natural defense mechanism that occurs when an individual feels threatened or in danger. It is a primitive survival mechanism that is present in all animals, including humans. When a person perceives a threat, the amygdala, a part of the brain responsible for processing emotions, sends a signal to the hypothalamus, which activates the body's fight or flight response. In some cases, however, when the threat is perceived as overwhelming or impossible to escape, the body may enter a state of freeze. The freeze response involves a range of physical and psychological changes that enable the body to become immobile and appear dead or invisible. This can include decreased heart rate and blood pressure, slowed breathing, and tensed muscles. In addition to physical changes, the freeze response can also impact cognitive function, such as decreased awareness, impaired memory, and reduced decision-making ability. The individual may feel numb, disconnected from reality, and unable to react or respond to the situation. The freeze response is often associated with trauma and PTSD, where individuals may experience a sense of helplessness or powerlessness. For example, if someone is assaulted or threatened with violence, they may freeze to avoid further harm. In such cases, the freeze response can serve as a protective mechanism, allowing the individual to dissociate from the traumatic experience and avoid emotional overload. However, the freeze response can also be triggered by everyday stressors, such as work-related pressure, financial difficulties, or relationship issues. Individuals who experience the freeze response may feel trapped and unable to escape the situation. They may feel stuck, paralyzed, and unable to move or take action. This can lead to feelings of shame, guilt, or self-blame, as the individual may perceive their response as a sign of weakness or inadequacy. Moreover, the freeze response can create a vicious cycle, as the individual may avoid situations that trigger anxiety or fear, leading to further isolation and avoidance. The freeze response can also have long-term effects on an individual's mental and physical health. Prolonged exposure to stress and anxiety can lead to chronic conditions such as depression, anxiety disorders, and chronic pain. Moreover, the freeze response can impact the individual's sense of self-efficacy and agency, as they may perceive themselves as powerless and incapable of coping with challenges. Treatment for the freeze response depends on the underlying cause and severity of the symptoms. In some cases, therapy or counseling can help individuals identify triggers and develop coping mechanisms to manage anxiety and stress. Techniques such as cognitive behavioral therapy, CBT, or exposure therapy may be useful in addressing specific fears or phobias. In other cases, medication may be necessary to manage the symptoms of anxiety or depression. In addition to therapy and medication, lifestyle changes can also be helpful in managing anxiety and stress. Engaging in regular exercise, getting enough sleep, practicing relaxation techniques such as meditation or yoga, and maintaining a healthy diet can all help reduce the symptoms of anxiety and promote overall well-being. In conclusion, the freeze response is a natural survival mechanism that occurs when an individual perceives a threat as overwhelming or impossible to escape. While it can serve as a protective mechanism, it can also lead to feelings of helplessness, isolation, and avoidance, which can have long-term effects on mental and physical health. Understanding the freeze response and its impact on individuals who experience it is an essential step in addressing anxiety and related conditions. For those who experience the freeze response, seeking help from mental health professionals can be a vital step in managing symptoms and improving overall well-being. Additionally, developing healthy coping mechanisms and engaging in self-care practices can help reduce anxiety and promote a sense of control and empowerment. Ultimately, the freeze response in anxiety is a natural and understandable response to perceived threats. By recognizing its role in our survival and addressing its negative impact on our lives, we can learn to manage anxiety and stress more effectively and live healthier, happier lives.